All this is Dr. Mobeen Sayed from drbeen.com. And somebody had asked me this question that what do I say in the beginning of the discussion? So it is all. This is Dr. Mobeen Sayed from drbeen.com. So the word is all. All right. So let's start our discussion. Today we are going to talk about minks and masks. I'm going to talk about WHO and CDC as well, and some of the issues that we are seeing with their these two agencies once again. So let's start a discussion. I'm going to share my screen and we would go over this news together. So this is drbeen.com. So here is WHO. So I'm going to go over to my illustration first. So some updates about the cool beans, and of course Luffy is here chiming in as well. So some updates on the cool beans. The cool bean doctor from Greece, I think he has recovered a lot. His parents have recovered as well, and they're doing good. So he is now preparing. I had requested him to write a report about himself because his antibodies appeared very late, plus himself and his mother responded very well to hydroxychloroquine and zinc, while his father responded better to ivermectin. So I thought that was an important thing to discuss and to share. So he's writing an article about it, so I would share that with you. So that is one update. The second update is the cool bean whose father, 70 years old, who was declining very fast, and since ivermectin has recovered, so now I think we can stop reporting on him as well because he seems to have recovered very well too. In the meantime, the same cool bean's mother developed the symptoms as well, but she has not declined that fast, and mostly just headache and some fatigue and sore throat kind of symptoms are what she's experiencing. But for her, I had started her right from the very beginning on ivermectin. So this is two. And then thirdly, there is another cool bean here from the USA. His name is Patrick. He actually offered to come on here in the program and discuss the experience he had with COVID-19. So the interesting thing there, which kind of intrigued me as well, and if you would like, then I would invite him as well. And that was that his girlfriend and him, they both developed COVID-19, and they went for ozone therapy. And after that, they are recovering very well. Or I think his girlfriend went for ozone therapy and she's recovering well. He is recovering much better. He was asymptomatic. She had developed more symptoms. So I thought that that was an interesting therapy as well, that it would be great to listen and hear their experience and what they had done. So if you would like it, then I can request him to come in as a guest. He offered to come in as a guest as well. So this is the updates on the cool beans. Now let's look at the minks and Denmark and WHO. So look, do you remember that last time when the SARS-CoV-2 pandemic started, WHO took a lot of time to come out and say, there seems to be a pandemic, there seems to be a problem that is bigger than just within China. And then they took a lot of time to actually declare the state that we are in now. I think they went on till March. That is the same thing that they're doing now with Denmark as well. So again, I have nothing against Denmark or against China. The only thing is these organizations, they should behave scientifically instead of, and I would show you their advice and you would be surprised. They just had this experience, WHO. They just had this experience. They just saw what happened when they were late in trying to contain a mutation of this virus. And now they're seeing the mutation again, and they're saying, okay, no worries, travel should not be banned, just continue on. I think that nowadays travel is already restricted, so why not restrict travel for some more weeks and then start it again after assessing the situation? By the way, in one sad outcome of all of this is that minks that are formed in Denmark or the minks that are present in wild, whatever minks they are going to get, they are going to kill them. So that is the sad part. That is the heartbreaking part. And unfortunately, I think you know that minks are only raised for their fur anyways. So they are unfortunately bred and then killed for their fur. So mink, I think coats are very, very exotic and used. So let's look at how WHO positioned themselves with this mink. And I want to show you a sentence which was alarming for me. Let's see if you can catch it as well. So here, WHO says that since June 2020, there have been 214 human cases of COVID-19 in Denmark, which have a variation of SARS-CoV-2. So please notice this variation of SARS-CoV-2. There's a mutation. So you can get back to me and say, Dr. Mobeen, you talk about mutation every day, that SARS-CoV-2 is mutating in us as well every day. So what's so special here? Look at this sentence. Look at this. This variant, referred to as the cluster 5 variant, had a combination of mutations or changes that have not been previously observed. And look at this, moderately decreased sensitivity to neutralizing antibodies. So if I have SARS-CoV-2 today and my body has made neutralizing antibodies, or if I am given a vaccine with this spike protein that has created neutralizing antibodies against this spike protein, or if I'm given a monoclonal antibody during my active disease, which that antibody is against the spike protein, then read this sentence again. Moderately decreased sensitivity to neutralizing antibodies. That means this mutation is, number one, mutated enough that neutralizing antibodies are less effective. Number two, it is mutated enough that it has jumped into humans and survived there as well. So that is the bad part. That is the bad part. This is what happened before as well, that from some animal in China, the virus jumped to humans. Here we know it is minks and it is jumping to humans, 214 cases in humans, and then out of them 12 cases with unique variant reported on 5 November. All 12 cases were identified in September 2020 in North Jutland, Denmark, reported in 5 November. So there is mutation. That mutation is kind of able to, I do not know what do they mean by moderately tolerant to the neutralizing antibodies. I do not know what their scaling is, but one, it is mutated enough to go in humans, and secondly, in humans, we are not able to contain it very well. So this can actually become another pandemic on top of the current pandemic. And I want to show you, I'm angry. I want to show you WHO's response. And what really bothers me is this. Some lab here in Boston or in San Francisco is going to get up, take that virus, and within a week say, we have made neutralizing antibodies for this variation. That means they would reverse engineer the virus, they would look at the virus, they would decide what is exactly the change, and they would decide how to kill it. Why cannot WHO do that? Because I'll show you some statements from WHO on this page, where they are simply saying we need more information. Have they ever deterministically done anything since the beginning of this pandemic? Every single page you read from them, they continue to say, we are waiting for more data. We are trying to understand more. We are working with this country. We are working with that. That all is just incompetence and laziness. So see there, moderately decreased sensitivity to neutralizing antibodies. I do not know what does that mean. Then if we continue on, minks were infected following exposure from infected humans. So this is the case where SARS-CoV-2 jumped to us from some animal in China, then reached in all of us. Then from us, it has jumped to minks. And now it is jumping back from minks to humans. So Minks can act as a reservoir of SARS-CoV-2, passing the virus between them and pose a risk for virus spillover from minks to humans. And we are seeing that risk. Then continuing on, public health response. What is it that is being done? Number one, culling of all farmed mink. So they're going to kill them all. More than 17 million minks, poor species, creatures, they're going to be killed, number one. Then enhanced surveillance, expanding the percentage of sequencing of human and mink SARS-CoV-2 infections. So they're saying we'll keep an eye on it. It's essentially that other than killing all these animals, they're saying we're going to keep an eye on it. WHO risk assessment. This is what WHO did since the China had reported the problem. And look at the same behavior again. Look at this. These investigations, so they're saying we are now investigating. These investigations take time and are done in close collaboration between different research groups. This is a statement to say we are actually just whatever. Then they're talking about some more. And if you read all of these paragraphs, the summary of each paragraph is, that's it, it's happening. Now, what is WHO's advice? That is very interesting to see. WHO advises further virological studies should be conducted to understand the specific mutation described by Denmark and to further investigate any epidemiological changes in function of the virus in terms of its transmissibility and the severity of disease it causes. What a long sentence. They don't even know how to write. WHO advises all countries to increase the sequencing of SARS-CoV-2 viruses where possible and sharing the sequence data internationally. Cool. So they're saying, we'll keep an eye on it. Please, you keep an eye on it as well. But look down here. This is what is not right. WHO advises against the application of any travel or trade restriction for Denmark based on the information currently available on this event. They did the same at the China time. And please, when you're listening to this discussion, it's not about Denmark somewhere in Europe and China in Asia, and there is a problem that we should do something to Asia and not to. There is a risk here. What have we done with the current pandemic? We have proved, WHO and CDCs and FDAs, they have proved that we are not able to handle these things. And then here is one more risk. And they are simply saying we are advising against travel or trade restrictions. I think trade can continue. Travel restrictions, we have become used to living and earning for a majority of the part with restrictions. Instead, they're saying this is fine. And what would happen is now we would start seeing the spread of this variant. Then WHO would come back and say, God, there is a new variant here. We do not know what to do about this. And please wear masks and please do social distancing and please be careful. And we would figure out how to have the new vaccine and we have nothing approved. They would do the same hoopla as they did before while people died. So this was what bothers me is they are just going through their own incompetence and the whole world is going through their incompetence. They did not learn a lesson. They could have over here said, we really do not want you to take a risk anymore. We are going to ask the Denmark folks to take care of all of this and for 2 or 3 weeks, no travel, and let's see what is the situation. We advise against the travel or trade restriction. This is WHO for you. Okay, so enough of my anger here. Why I'm angry is we cannot afford one more variation that can evade the neutralizing antibodies. That means it's altogether a new infection. We cannot afford it. Humanity cannot afford it at this time. Okay, so this is the Minks and Denmarks and WHO. Now let's talk about masks and CDC. And I've done this discussion many times about masks and CDC, that CDC doesn't really look like they understand the difference from their elbow and their something else. Here is CDC on masks now. And you know that I've talked about this before as well, that no mask and yes mask and this mask and no droplets and yes droplets and no aerosol and yes aerosol. This is CDC for you. And now today they are talking about please wear. So I'm going to give you the summary of this first and then we'll go over it. They're saying please wear polypropylene masks or high thread count cotton masks or masks that can have a filter added to them. And that helps by reducing the expulsion of the virus by 70 to 80% and by reducing the incoming virus by 70 to 80%. I had done, I think 4 or 5 months ago, I had done a video. I believe the title was "We Should All Wear Surgical Masks." And then I had done another video where the title was "Masks, Best Material for Homemade Masks." I had talked about it 4 months ago and talked about the type of material that can be used to help. And here they're coming out now and they're talking about it. So again, what they're talking about is a good thing. So it's not a bad thing. It's just that they're so late and we are looking at WHO becoming late once again. So look at it. SARS-CoV-2 infection is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Got it? It's a respiratory virus. CDC recommends community usage of masks, especially non-valved multi-layer cloth masks, to prevent transmission of SARS-CoV-2. Non-valved is important because from the valve, the air escapes and can take the virus out. Masks are primarily intended to reduce the emission of virus-laden droplets, so expulsion from you to others. And here is an interesting statement that they make that is important. And what they're saying is in the next line here, that 50% of transmissions are by asymptomatic patients who do not know that they are actually infected. 50%. So again, what they're saying is good. It is too late. November, this is the thing that was in January, and I believe I talked about it in March or April. And here they are coming out now in November. So there are two types of routes they're going to talk about. Block the exhaling of the virus, that is you transmitting it to others, and then blocking the virus that is coming in towards you from others. So the first one, source control to block exhaled virus. What is their message over there? They're saying cloth masks not only effectively block most large droplets, 20 to 30 microns, but they can also block the exhalation of fine droplets and particles, also often referred to as aerosols, 10 microns and below, smaller than 10 microns, which increase in number with the volume of speech and specifically type of phonation. If you're singing or if you're laughing, multi-layer cloth masks can both block up to 50 to 70% of these fine droplets and particles. Good thing. As much as I'm angry with CDC as well, this is a good thing they're talking about. It's just their time to wake up, I guess. So this is the expulsion of the virus. Now let's talk about the incoming virus. That is the filtration for personal protection. Wearer, so if you are wearing a mask, wearer exposure to infectious droplets through filtration, including filtration of fine droplets and particles less than 10 microns, the relative filtration effectiveness of various masks is varied. But what have they found is in some cases filtering nearly 50% of fine particles that are lesser than 1 micron. This is exactly the discussion I had done. that on the expulsion side, 70 to 80% of the aerosol and the droplets are reduced or captured in the mask. And on the incoming side, more than 50%. Now, this is important for all of us. This is practical for all of us. Some materials, for example, polypropylene, may enhance filtering effectiveness by generating triboelectric charge. Remember that charge, in the cold time, if you rub your hands and then you bring them to your hair, that static charge. So the polypropylene can have static charge, which causes the virus and the particles to be stuck to it because of the charge. So good. Then others, for example, silk, may help repel moist droplets. So silk would allow the moisture to stay away, and so that is how it would repel. And reduce fiber wetting and thus maintain breathability and comfort. So good news that they're talking about various fabrics and various materials. Then they have talked about some human studies. So this is, I think, an interesting one, and we should all look at it. They have some studies given here. One study, the very top line, here they're talking about two hairstylists who themselves were symptomatic. That means they had COVID, and they wore the mask, and their clients wore the mask, and then they handled 139 clients. Out of those 139, 67 of them accepted an interview, and I think none of them became sick. So that is the power of mask. Then in another study, 124 Beijing households with greater than one laboratory confirmed cases. So households where there was at least one case of COVID-19 or more than one. And they were wearing a mask, and their family members were wearing a mask. And the secondary transmission was reduced by 79%. So again, a good news. Then another study from Thailand, where 1,000 persons were interviewed who had been roaming around with the masks on. And once again, they saw 70% reduction in acquiring the infection if you have a mask on. Then one more study from the USS Theodore Roosevelt, the ship, the huge military ship or Navy ship. And over there, the people are actually congregated in closer quarters. And over there as well, those who were wearing masks had 70% reduced risk of infection. Then other studies, here the studies on the flights greater than 10 hours, where the chance of getting the infection is more. If people are wearing masks, the chance of infection is dramatically reduced. So there is a question from Overdressed. I need the link for these articles. Overdressed, so the description has the links. So these are articles on CDC and WHO site, and the description, my description to this video, has the links there. Then they talk about more studies. But here is an interesting thing. An economic analysis using US data found that given these effects of reducing the transmission by reducing the expulsion plus incoming virus, increasing universal masking by 15%, just by 15%, could prevent the need for lockdowns and reduce associated losses of up to 1 trillion or about 5% of gross domestic product. So as much as I like what they're saying, can you imagine this that they woke up now? So this is the, I think that I'm now just repeating myself out of my anger. I'm angry on these two organizations once again for not being able to do their work correctly. So this is the discussion for today. There is one more chance of pandemic if the Denmark mutation is not correctly countered and contained. And then masks are important for all of us. We should wear masks. So this is it. This is the discussion for today. I hope you're all happy and healthy and safe. I would see you tomorrow. Please like, subscribe, and share. And if you would like to support this work, there is a link in the description for support as well. Thank you very much, and I'll see you tomorrow.